talking congestive heart failure, and this is a very important topic. Hi, if it's your first time joining me, my name is Professor Regina. I'm so happy to be spending this new week with you. We're going to get into studying. Congestive heart failure comes from the V2 program. This is the training that I offer for nursing students who are trying to pass this NCLEX. I really developed this training for the student who needs to get back on track, needs accountability, and a quick review. If you want to try out the V2, it's super simple because you can do it for free. That's right, I have a free trial of the V2. Just go to remarnurse.com and you will be able to experience the awesomeness of the training course and how simple it is. And like I said, getting a free account will even help you to ask me better questions about it. Sometimes you need to experience something so that you know the questions to ask. And so free trial allows you to do that. Like I said, we're talking about congestive heart failure. It's in this book. I like to tell you exactly where to add these notes to it. I'm going to review it and take a different perspective for today. Congestive heart failure, bear with me, is on page 68. Okay, 68. So get out this book and let's dive into it. Congestive heart failure is when a patient's body gets into a situation where there is some sort of clinical condition. It's essentially heart failure. Okay. It's a clinical condition caused by a structural or functional defect in the heart. Now, that heart failure can be unfortunately caused by a lot of different medical conditions and, myocardial issues, pericardial diseases. These things can put a patient in this situation. There are 4 types of heart failure that you need to know. They are acute, chronic, and so these are going to delineate more of a time that this will bring about on a patient. Hi there, everyone. And then you have your left-sided heart failure, which kind of breaks down into 2 categories. You're either going to have a systolic issue or a diastolic issue. The systolic issue is just that the heart is not pumping forcefully enough to meet the demands of the body, right, in this situation. And the diastolic issue is that even though the contraction of the heart may be adequate, because there is not enough filling up of the heart, right, then the ejection that is taking place of the blood, of the oxygen, of the nutrients is inadequate. And so that would be consistent with a diastolic issue. And then right-sided heart failure. So going into more detail in the V2, make sure you know the difference between left-sided and right-sided. All right. I'm going to try to go over a little bit of those causes as well and the clinical manifestations. So causes, I said, were many for congestive heart failure. You can have impaired cardiac function. That makes sense. Myocardial disease, valvular heart disease. So if you have a regurgitation, you have a backflow of the cardiac system, congenital heart disease, constrictive pericarditis. If there is increased work demands of the heart, increased pressure work or increased volume work, and I'm talking about the workload of the heart, having to overcome these things. When there is a restrictive force, maybe your patient has cardiovascular disease, maybe, they're having hypertension. And so after a while, the heart as a pump can start to decompensate. And so this is where you have the issues. There's some other factors that will increase the risk of having congestive heart failure. Smoking is a top risk factor. Very difficult to stop smoking from what I know once you have developed this addiction. So there is a lot of education in preventing a patient from becoming addicted to nicotine. But once that happens, we really have to encourage patients to evaluate if the risks are worth the pleasure of it. Okay. Hypertension, obesity, alcohol, drinking, diabetes mellitus, and certain infections can actually cause what we're talking about today, congenital heart congestive heart failure. Congenital heart defects is on my mind. We're talking about congestive heart failure in this video. All right. Clinical manifestations, we have a breathlessness, okay? Breathlessness. And this can be at rest or on exertion, paroxysmal nocturnal dyspnea, and orthopnea, okay? Also wheezing, coughing, hemoptysis, all right? You have some bloody sputum, fatigue, poor activity tolerance, okay, and ankle swelling. Wow. Okay, so these are clinical manifestations. It is going to be important for you to understand why these things are happening to your patient. What would the cough be indicative of? All right, why is fatigue happening? When we talk about right versus left-sided heart failure, add these to your notes in your V2 workbook if you don't have them. For the left-sided heart failure, you are going to have fatigue. All right, you're going to have pulmonary symptoms. It is also common for patients with left-sided heart failure to have palpitations, diaphoresis, tachycardia, pink-colored sputum, and a reduced pulse pressure. Yes. So this condition manifests itself in a very particular way. Whereas if we look at, you guys have all of these? Okay, you have all these? All right, I'm going to move to the next slide. You ready? Let's go. Right-sided heart failure, you will have a situation where your patient has pulmonary embolism. They're going to have fluid overload, but you'll see it in a systemic way. So they're going to have systemic congestion. They can have cor pulmonale. They can have cirrhosis. Cirrhosis of the what? Cirrhosis of the liver as well, because you're having issues with fluid overload. So NextGen can pull out these kinds of clinical manifestations and ask you to categorize, is it left-sided or is it right-sided heart failure? Our diagnostic tests make sense for the issue that we are trying to investigate. So an electrocardiogram, an ECG, this will be helpful in determining if there's any arrhythmias present or if there's maybe another cause of your patient presenting with fluid overload. We need to know. Blood workup, we're going to look at the CBC, the complete blood count. It will include the electrolytes, calcium, magnesium, potassium, of course, the liver function test, fasting blood glucose test, thyroid function test. And again, a lot of the times when we are doing laboratory work, we are trying to essentially rule out other conditions. So the laboratory values give us an internal picture of our patients that we need as part of an assessment. This is why nursing school introduces laboratory values very early on. But sometimes the instructors don't make the connection with the picture that is developing based on the laboratory values. And so we have to close that gap and make sure we understand it before we are taking the NCLEX. So what does a low calcium level, what does that look like in terms of the condition? Okay. Congestive heart failure. Why do you care about it there? Okay. What does a low calcium level look like when your patient has had a thyroid procedure? All right. So we have to be able to move fluidly through the content, just like I presented with you here. Okay. Exercise test, stress test, coronary angiography understand what that is. Cardiac MRI and an endomyocardial biopsy can also tell us the health of the tissue of the heart. If we are talking about the pharmacological management of congestive heart failure, you are going to be looking at administering several classifications of medications. So, understanding congestive heart failure, you have diuretics. Diuretics are appropriate because they help get rid of what? Fluid, right? You have your cardiac medications. We need to support the heart. So beta blockers do that. Inotropes do that. You have ACE inhibitors. They have a function. Aldosterone antagonists and angiotensin receptor blockers, or ARBs. If you have quick facts for NCLEX, you will find information about ACE inhibitors, beta blockers, ARBs in this book as well. So a part of your studying process has to be a mix of lectures, okay? It has to be a mix of reading, and it has to be a mix of self-evaluation. All those things will support you during this process. All right. And I didn't even know this slide was coming up, but yeah, you'll find all of those things in the V2. So study with me when I get off of this live there. And if people ask me, what's the difference between the YouTube videos and the V2 videos? Big difference, big difference. You can watch YouTube videos all day long. They will be all on different subjects. Even if you leave this channel and go to another one, even if you stay on this channel, you are going to get multiple subjects on NCLEX, which is great. But those subjects, and this is the gag here, guys, those subjects are not positioned in a systematic way for you to have a big picture understanding, okay? And as much as I think I do the very best in education, the training in the V2, because it is in a specific order, helps you much faster to get to where you need to be. So I'm saying, don't just watch YouTube videos and then be disappointed when you don't have the understanding as quickly as you should. All right, do the training. I want to do the NCLEX questions now because congestive heart failure is actually a very straightforward subject. And I'm coming on here to really reinforce the things that I told you were important points. So all of you, if you have done at least up to study session number 13, you should have come in contact with the congestive heart failure information. You're ready for these questions. You're ready for these questions. Here they are. Here's the first one, okay? I'm expecting 3 out of 3 today. I don't usually say I want 100% perfection, but these questions, you can reason with yourself, and I want you to come up with the right answer. Even if you're not confident, go with your first mind, and I believe that you will get the right answer on these questions. Here's the first one. Congestive heart failure is the topic. A nurse is caring for a client with congestive heart failure and reports weakness and shortness of breath, okay? This is a left-sided heart failure as evidenced by, number 1, fatigue and dyspnea and wheezing. 2, peripheral edema. 3, decreased pulmonary artery pressure. Or 4, hepatomegaly and oliguria. So a patient with congestive heart failure, they report weakness and shortness of breath. This is a left-sided heart failure as evidenced by what? Is it fatigue, dyspnea, and wheezing? Peripheral edema? Decreased pulmonary artery pressure, or hepatomegaly and oliguria? The correct response is yes, number 1, fatigue, dyspnea, and wheezing. So when you have the congestion on the left side, you're going to find it mainly in the lungs. And so it's going to be caused by an inadequate ejection of blood into the systemic circulation. So for whatever reason, there is a backflow and it becomes pulmonary congestion. All right. So if you have shortness of breath, which is dyspnea, sneezing, coughing, rales, and fatigue, these are common symptoms of left-sided heart failure. All of the other symptoms were more right-sided. Did you get that one right? Good job, everybody. That one was almost flawless. Okay. Question number 2 is this. All right. The nurse noted that the client with heart failure has been having arrhythmias. Which of the following medication the nurse is expected to administer? Number 1, spironolactone. 2, enalapril. 3, carvedilol. 4, losartan. This is a good one. Pharmacology, basic pharmacology question. Happy Monday, Remar nurses. Welcome to Monday Motivation across the nations. Now, got nurses from all over. Okay, you probably are down to 2 and like, I don't know which one to pick. You do know which one to pick because I told you, look for the answer. Where? In the question. It's right there. Correct answer is going to be number 3, carvedilol, because what are we talking about? We're talking about arrhythmias, and we know that the beta blocker helps to improve the pumping of the heart, the contractions of the heart. Some of you got confusing. You picked enalapril. Enalapril is a what? It's a blood pressure medicine. It's going to help dilate the vessels, which is great. But the problem here is what? Arrhythmias. So you have to be able to make that connection to the right answer. Okay. I'm moving on. Are we still 2 for 2? Some of us are 2 for 2. Okay. Third question is this. A client with congestive heart failure suddenly becomes short of breath. After placing oxygen on the client, what is the priority nursing action? Number 1, assess the vital signs. 2, administer diuretics as prescribed. 3, raise the head of the bed. Or 4, call the healthcare provider immediately. Oh, this is good. So this is an extension of prioritization because usually you typically will see put oxygen on the person. I already know you know to pick that first. So I want to know, what do you do as a priority after the oxygen is placed? Because everybody know to put oxygen on the patient if they're having shortness of breath. But then in this situation, what is the next thing that we need to do as the priority? Do you know it? Correct answer is boom. Number 3, raise the head of the bed. You got to raise the head of the bed. All right, particularly if you're raising it to a high Fowler's position, because this is going to help improve the lung expansion and help reduce the work of breathing. And that's something you could do immediately. You wouldn't delay this. You got to do this, okay? Raising the head of the bed. You can call the doctor. You can get the vital signs. Those things are still part of your assessment and are very important to notify the healthcare provider. But we got to focus on the patient right now. And for the patient, the best thing for us to do is to, boom, raise the head of the bed. Very good. Very good. Okay. Now, how did you do? How did you do? Congestive heart failure is one of those subjects that actually, if you have an understanding of congestive heart failure, it will help you in so many other subjects. Congestive heart failure will help you to understand pregnancy better. It will help you understand your kidneys better. It will help you understand ears, like Meniere's disease, even better. So that is one of the subjects I would say definitely spend time with. I think I go over it. Let me see. Do I go over it too no, I go over it in if you have quick facts for nursing school. All right, if you have quick facts for nursing school, you are going to get an in-depth on congestive heart failure, and then I lecture on it in the V2. So I think that's why I didn't put it in here, because I lecture on it in V2. But quick facts for nursing school also has it. Let me see. Let me just fact check my own self. All right. For those of you who hopefully you guys got it on the Christmas sale last week. All right. And so you're going to find it on page 31. You're going to find it on page 31. It is part of studying. Okay. And if you're in nursing school, I have a great surprise for you guys who are going back to nursing school. I can't wait. I can't wait. I cannot wait. All right. Also, shout out to my partners in Africa, Callion Nurse Consultants. They are doing amazing, helping us to get V2 throughout all of Africa so that the nurses can pass the NCLEX and come over to the U.S. to work. Come over to the U.S. to work. I want to see you here. If you're in another country that's not Africa, we will ship the books directly to you. If you're in Saudi Arabia or the Philippines or Canada or Jamaica, you just go to the regular website, remarnurse.com, to start training with me. It's Monday, so we also do Monday motivation across the nation. Seek and you will find. Oh man, seek and you will find. Now, what do you think I mean when I say this? What do you think I mean when I say this? Because I bet this Monday, you have already looked for something. Whether it was you woke up this morning and the first thing people usually go to is what? What do people usually go to when they wake up in the morning? First thing people usually grab is what? Start looking around for your cell phone. People in the morning are looking for their cell phone. Some people are looking for their glasses. People are looking for their glasses. Some people are looking for their coffee. We're always searching for something. We're always feeling like, especially on Mondays, we got to go, we got to do, we got to get. We are so guided and so governed by time. It is constantly pushing us to the next thing and the next thing. And I think it really, sometimes it gets in the way of us just being able to enjoy the moment, because we're always thinking, oh, I got to go. I'm only here for 5 minutes, or when is this going to be over with? So we're constantly seeking for something else. But on this Monday, I want us to have a different perspective than any other day. Okay. So on Mondays, I want us to remember that there is one most important thing that we need to seek in order to succeed in life. And this has to be a really prevailing thought, because there's somebody that's going through a big challenge right now. I don't know if it's like financial. I don't know if you're considering a divorce, or there might be somebody that's really like, I am not getting what I need to get out of a situation. Okay. And so we're seeking what's best for us. We're seeking what the decision is I need to make. We feel pressure on that. But when it comes to seeking, remember this, Hebrews 11:6. And without faith, it is impossible to please him. For whoever would draw near to God, what must they do? Do they have to run a marathon? Do they have to memorize the Bible? Because what's missing sometimes is God. And when we are endeavoring to get close to God, what do we think we have to do? We think we have to, I have to pray more. Oh, I have to get back into church. Oh Lord, I gotta, give my money to the poor, or I have to, restrict myself and fast and pray. Those things are important. But the Bible says that if we're trying to seek him, if we want to draw near to him, what must we do? We must believe. And what I like is that there is no, there's no works that are involved. We must believe that he exists and that he rewards those who seek him. So this tells me is that on Monday, all today, it's not about what I must get done. It's not about what I must be seeking. Like, first of all, is my mental right? Am I mentally in a position to succeed? And the Bible says that starts with me believing. I have to start there. I have to, number one, believe God is who he says he is. Because if I can believe that God is who he says he is, then I know he doesn't break a promise. He cannot tell a lie. God is love, right? God wants me to win. God has already won the victory for me, right? I have to believe that I have a reward coming from him. And it may not be today. It may not look like what I think it's supposed to look like. Remember, the disciples were like, yo, Jesus, so when are we going to take out this Roman army and establish your kingdom? Because they were ready to fight a physical, war. They were ready to fight a physical battle. And Jesus had to be like, no, that's not what this is. Like, my kingdom is in heaven. I'm not even worried about this down here. All of this is going to go, right? I'm bringing in something new. And so what God thinks as a reward for your life may be very different than what you think you deserve as a reward. So if you are in a difficult situation right now or in a different period, trust that God sees you and that he has you in this position because you have the strength to endure it. God doesn't put more on you than you can bear. So in these moments, you need to think about, what am I believing about God? What is God trying to show me? What am I supposed to be developing in my character? Because your character is what you take throughout your life, not your looks. Okay. That's going to go. But what you will carry on and pass down to the generations that come after you is a character. Are you dependable? Are you loving? Are you patient? Are you kind? Are you long suffering? So that's it's just a great positional statement for us, that for whoever would draw near to God must believe that he exists and that he rewards those who seek him. All right. So faith is necessary. Okay. You have to have it. There is a reward in this present life, but there is a reward in the future life. And I cannot wait to experience with you all, by God's grace. And God, actually, all that we are getting and all that we're striving for, we talk about NCLEX a lot and getting the nursing license. That's great, but God is the real prize, and you have him today. So how are you demonstrating that gratitude? How are you demonstrating the love that you have? Like, boom, God, thank you for this new day that I've never seen before. Thank you for, me being able to just have a presence of mind, have a goal. There are people who are severely depressed because they have nothing to look forward to. They feel like they don't have anything to enjoy. There is no pleasure nowhere. And you have a goal that you're reaching after, and you have a goal that is motivating you to get up and do. I love that for you. I love that for us here. On Mondays, we have goals. We have built-in community goals. So thank you so much for spending your studying time with me today. I hope that I can see you again and again and again and again. If you just give me about 4 weeks, okay? Give me about 4 weeks. Let me change your life. Let me give you the knowledge to help you make the connections so that you can go into your NCLEX exam confident, and you can really believe, after going through the V2, that I can, I will, and I must pass NCLEX. I'm going to do it. See you guys later. Bye-bye.